John, talk to us about the intersection of technology, healthcare technology, and the patient experience.
So I think what's interesting is many people assumed that if they implemented technology, it would just somehow miraculously improve the patient experience. And now many doctors have found that technology in itself doesn't solve it, and in fact, in many cases, it could make it worse. In fact,
How so?
I mean, if you look at meaningful use, we spent $36 billion on EHR software that unfortunately in many cases ruined the patient experience because it made the doctor's life more difficult. They had to spend more time on the computer rather than with the patient. Now there's exceptions, right? I mean, we expanded the portal, and so that is one patient experience that could be better. But of course, many people, to meet the meaningful use requirements, didn't create a great patient experience in their patient portal. They just slapped the patient portal in and said, oh, we have a portal, and now they say we're all good, right? So if you want to improve the patient experience, then what you have to do is implement technology in a thoughtful way. So you have to evaluate the workflow that's going to make sense for the provider and facilitate that connection between the provider and the patient. Or, and when I say provider, I don't just mean the doctor. I mean the nurses, the front desk staff, whoever's providing the service to them. You need to think, how is that going to go all the way through to the patient? We don't just need to think about, oh, will I be able to check the checkbox on meaningful use or macro or MIPS, and then I can get my money. No, if you want to affect the patient experience, you have to really do a thoughtful approach to the implementation.
So, follow-up question on that. What's the government's role? Should the government just back off with the regulations and requirements and other things that they're implementing? Do they just need to back off so that caregivers can focus on patient experience?
I think largely the government should back off, at least in many ways. There are certain areas where it makes sense for the government to be involved, and they should incentivize the outcome, not the specific implementation. And that's the failure that we had in meaningful use, and I think that's the lesson we learned from it. Government can incentivize things, and when they give money, oh my gosh, healthcare responds incredibly, right? I mean, meaningful use made doctors completely insane, right? They started making crazy decisions because they wanted the government money, even though they made no business sense to them to do in other forms. And so government money matters and can incentivize the right things, but instead of incentivizing the specific action that the organization should take, they should incentivize the outcome. So a good example, we want healthcare interoperability. If we had that, the patient experience would be way better. I don't have to fill out that stupid form at the doctor's office when I just did it for 5 other specialists and I'm tired of doing it and now I'm ready to do it the wrong way, right? So if they incentivize the sharing of that data, that's something worth paying for. But they shouldn't say, oh, you need to do CCDA version 3 of whatever, right? They need to just say, this is the outcome we want, and so then people will do it, but don't prescribe the specific method.
So one thing, John, that macro MIPS, some of the other government mandates and have forced physicians to do is to think about implementing technology more rapidly. At least it was successful at that. So how do you get the government out of the way, but still get that rapid implementation of tech?
Well, I recently wrote about how it's a real challenge for doctors to understand all the innovation that's happening. And so, meaningful use was great because it told them you need an EHR, and so then they had a prescriptive way to implement it because they knew, I need a certified EHR, I need this, right? So I think we need to create tools and frameworks that help doctors discover innovations better. And I haven't seen this yet, unfortunately, but maybe it's a peer framework that shows who's using what to help bubble up the interesting innovations that a doctor could actually use. Because if they see something start to bubble up, almost like the on your app store on your cell phone, it shows you here's the top ones, and then everyone downloads the top ones because they're like, oh, these must be interesting. We need that for doctors so they know what innovations are best. And we have to remember one thing that's really important. There isn't one healthcare community. There are hundreds of healthcare communities. There's the OBGYN community, and there's the OBGYN community at a small practice and at a large practice and at a health system. There's a orthopedic surgeon community and all these specialties and even regions. And so it divides, and so there's hundreds of specialties. And so we need an app store for all of those communities that shows what are the best apps, what are the best services, what are the best implementations, what are the best analytics, what are the best solutions that will make this organization run more efficiently, save money, provide a better patient experience.
So it's crowdsourcing. It's provider side reputation and review driven implementation of tech.
And not just review, but you have to go, what are they actually using? Because a review can be gamed, right? So you need to have it based on usage. If we had the usage data around who was using what, we would learn a lot more about what was actually useful and what was the impact of that technology on the organization.
Interesting. So John, one of your themes is patient voice. How do we listen to the patient better? How do we get that patient voice into the healthcare environment better?
Yeah, so there's a real challenge. And some people that are advocating for more patient voice involved in healthcare technology like to say, oh, there's no voice. And I don't think that's true at all, because most of these organizations care deeply about patients.
Yeah.
And they talk to many patients. But the problem with it is one patient voice is just one patient voice. And they're speaking from their viewpoint. And it turns out that some patients are better at abstracting their view across a larger body of patients, and some aren't. And so if you listen to certain patients, they might be great for them, but it might not be great for the population as a whole. And so we need to involve more patient voices and people who understand how to speak for the whole population, or at least a larger population than just their own individual personal needs. Because that's kind of natural human instinct, is I should speak for what I know and what I experience.
Sure, yeah.
But there's certain people that can abstract it and say, hey, I've talked to hundreds of patients, and this is what we've seen in 90% of our patients. And maybe they don't give those specific numbers, but when they say something, it has that impact because they're speaking from a broader perspective of understanding. So I think that's the first thing, is making sure that we talk to enough people so we get the broad perspective of what's happening. We need some chronic patients involved. They're a smaller population, so they're harder to get that voice. We can get the healthy population like you and I that are relatively healthy, and we want to do it. So we hear that voice more because it's 90% of the population. Although, we might argue with diabetes that will change over time, but for now, we feel healthy, right? So we don't speak from a chronic patient. And so these 10% are almost like discriminated against. They're almost discriminated against because they're a smaller group. So we first need to reach out to them so we involve that voice, because they cost our health system a lot of money. But we also need to include this voice as well. And then the other thing is this. Some people like to say we're all patients, which I guess in the fundamental sense, we've all been to the doctor, so we've all been patients. But that doesn't mean we're speaking from the patient view.
Yeah, great point.
We might be speaking from our own company's view if we're trying to sell a health IT product, or we may be speaking from our health system's view, or we may be speaking from some other view. We may not be speaking from our view as a patient. So it's important to remember, if you want the patient view, you have to invite someone to speak from that perspective.
Yeah, that's a really good point. So how does that jive with the drive to be more individualized, to be more personalized? Because you're talking about aggregating thoughts, right?
Yeah.
And speaking for a broader population effectively, but at the same time, healthcare is going more personalized.
It is. Well, and I think when you build products, you have to keep all of those people in mind. And while machine learning and neural networks should eventually get to the point where I don't need to talk to you, I can gather all your data and understand who you are, we're not there yet.
Yeah.
So until we get there, we have to involve as many people's views as possible. And what's astonishing is how many little insights you can get from patients and users of your system that you can incorporate, that you're like, why didn't I think of that?
Yeah.
And it's because we are conditioned by our own experiences and our own biases, that having someone without those biases and with other experiences can give you new insight that you're like, oh yeah, well, that makes sense, but I don't know why I didn't think about it before.
Sure. So how do you catalog those? I mean, it's nice to listen to a patient, but unless you properly catalog it and incorporate it, it's meaningless. So talk to us about that.
For sure. And we see a lot of organizations put together patient councils, and I think that's a great way. If you have a patient council, you can get the feedback, but if you report on that feedback and what was done, then you will improve that experience. Because if you have to report it, we all know if you report it, then it improves productivity.
Right. Yeah.
It improves the results of what you're measuring. So, you have to track it, report it, and if you report back to that patient council and you're like, oh, well, you gave us these 5 advices and we did nothing, well, then the patient council is going to, 1, hold you accountable, and 2, say, I don't want to work with you because you're not listening to me anyway.
Right. Okay, great.